Thomas.
Hi.
Hey, how are you doing?
Doing okay.
You doing good? I know you're probably ready to leave.
Yeah.
So I'm glad to tell you that you're all set to go. So I just want to go briefly over some discharge instructions with you. It's going to be a lot of information, so I'm going to give you this little brochure. Mind if I set that right there?
Yeah.
That's going to be, you can take that home with you. But just to give you some reference as you go along. How's little Blake doing?
Good.
He's good? Okay,
Yeah.
Good. So, yeah, it's going to be a lot of information. I'm going to hit the main points, and then, but you can always refer back to that brochure. So, I'm glad you're doing better. So, over the next few days, you're going to notice some vaginal discharge, but it should gradually lighten up. And did you know it can take up to 6 weeks after birth for that discharge to be cleared up?
Okay.
All right. And then, so just be careful around the house. Don't pick up anything more than 10 pounds for the next 6 weeks. And I know you were trying to get back in shape, so don't go too hard. Don't be too active because it can increase the bleeding.
Okay.
All right. But there is some note. I do want you to, if you see any signs such as the ones I'm going over, some of these signs, it can be a sign of postpartum hemorrhage. So if you notice that you soak a pad more than and 1 pad per hour, if you notice that you have vaginal bleeding that does not stop, your skin is pale or you feel nauseous, blurry vision, chills, clammy skin, fast heartbeat, then I want you to call 911, okay?
Okay.
All right, that's regarding the vaginal bleeding, okay? But you can also, there's also a chance that some women experience elevated blood pressure after birth. So if you have a severe headache, if your hands and limbs feel tingly or there's, some swelling, that's also a situation where you would call 911, okay? So it's going to take about 6 weeks for your body to get back to normal. So you're going to experience some discomfort when voiding. And then you can also, we don't want you to strain too much too. So you can ask your doctor about any laxative that you can take, because that can also be a good cause to cause some hemorrhoids if you strain too hard. You can also use Tux pads and hemorrhoid cream for relief. Now, did you have any questions so far?
I don't think so. Do you know how long it might take for my stomach to go down?
That usually, everything usually goes back to normal, and it's just.
Is it the 6 weeks too?
Yeah.
Okay.
So everything is just gonna just go back to normal. So your body has to readjust.
6 weeks is a long time.
Yeah, it is. So, and you notice that you may have noticed that the baby doesn't breathe like me and you, and so baby's breath is very episodic, and they can take as long as 10 seconds in between breaths. So just keep an eye on it. There's nothing to be alarmed. That's completely normal. But if you see like nasal flaring, it looks like they're grunting and struggling for breath, then that would be a cause of concern. So just something to look out for. And kind of help the baby to breathe better is they do have a buildup of mucus. So you just can suck that out, and because that mucus can make them gag. So just keep the bulb syringe around. Okay. And regarding the umbilical cord, that you can just clean that and keep it dry. Don't submerge it in the bathtub. Just use a sponge bath for now. And then eventually that could also take a few weeks to fall off too. So you don't need to pick at it, it's just gonna naturally fall off. But when you put on the diaper, just make sure the diaper is underneath the umbilical cord, right? And so you don't want the diaper to be rubbing up against it. But it's also something you also want to keep an eye on too, because if you notice like a smell or it's red or the baby starts to cry when you touch it, that could be a sign of infection. And like I said, everything I'm going over is going to be up in there, but I want to hit the main points for you. And so as you go along, the baby should gradually increase. The wet diaper should gradually increase. So you'll notice that by day 5 through 7, they should usually have about 6 wet diapers a day and like 3 or 4 diapers of stool with bowel movements. Okay, and you will also notice that do you plan on breastfeeding?
Yes.
Okay, so breastfed babies typically have like a yellow seedy stool, and that's completely normal. Regarding this is just safety information regarding the baby. Your baby should always be in a crib, and at least for the first 6 months, we encourage you to sleep in the same room, not on the same bed, but in the same room. And you want to remove everything from the crib. You want to use a nice firm mattress. Hopefully you have all those things ready. I'm pretty sure you do. And then you want to use, if you sense that the baby is cold, it's winter time, you want to use a sleep sack or some kind of wearable blanket if you think your baby is cold. And you want to keep everything away from the crib, like other furniture, window, drape cords, everything. Okay.
What's the concern about, I slept in the room with my mom. What's in the same bed? I'm sorry. What's the danger of sleeping in the bed?
Well, typically in the hospital, we have monitors and everything, so we can keep the baby. We can monitor the baby, but typically when a parent, it can happen that you could roll over in the bed on the baby, and basically the concern is that the baby could suffocate, or you could roll over the bed, or the baby even can fall off the bed. You see? Okay. So that's the reason. So it's best safe practice is just to have the baby in the crib for now and then. Does that make sense?
Mm-hmm.
Okay. Mm-hmm. All right. And so we're still talking about baby safety. So we're gonna talk about the car seat safety. So it's getting cold, and a lot of people want to put on big jackets, but you don't want to put on a big jacket on the baby. You want the car seat to be nice and snug. Mm-hmm. Yeah. Mm-hmm. And if you feel like they get cold, you can just drape the blanket over them. Okay. All right. And then normal is baby can sleep 11 to 19 hours a day, and it's quite normal for them to wake up in the middle of the night 2 or 3 times. So try to sleep when the baby sleeps, and don't be alarmed. Babies, I saw a meme about a baby that they could sleep through a thunderstorm, they can sleep through a train, but as soon as you might want to go to sleep, they're wide awake. Mm-hmm. They sense that. So just don't worry about that. They can sleep through anything. And then the dress and nail care. You want to typically what we recommend you doing is using a nail file to get to smooth out the baby's nails. For some reason, they love to scratch themselves. So just to keep it nice and smooth so they don't scratch themselves. All right. So I do want to touch on a few things about your breast care. And it's a nice guide here about when you sense that you have engorgement. And that's basically like if your breast seems full, there's a section here about engorgement, and it kind of demonstrates what you can do as far as expressing the milk to help relieve some of that pressure. Okay. All right. And then also you can use a warm cloth heat help set, and hand express that to relieve yourself. And then also in terms of breastfeeding, I'm just going over this information. if this is your first time. In terms of breastfeeding, you want to alternate. Here's a good, yeah, let's see. Here is a good demonstration of how to actually, different ways you can breastfeed your baby. And here's, you can, depend on whatever you want to do, there's different ways in which you can hold the baby. Like, particularly with my daughters, I know my wife, she loved doing the football hold. And then also, yeah, that's pretty much it. And then also you want to alternate sides, okay? But that's basically, did you have any other questions?
I don't think so.
Okay. All right, well, I'm going to get everything else ready for you. And congratulations,
Thank
by the
you.
way. You're welcome.